Hello, my name is Shamika Andrews, and today I'm going to take a few moments of your time to discuss medication errors. This is taught in your Nursing 330 course titled Law and Ethics for Healthcare Professionals at the University of Mount Olive's RN to BSN nursing degree program. This video is for my Master of Science nursing degree program at the University of Mount Olive. I have two goals for this brief lecture, and they are to explain what a medication error is and to review the 6 rights of medication administration. Let me give you a brief overview of medication errors. A medication error is a drug that is given any other way than how it was prescribed. Medication administration carries great responsibility. Medication errors are one of the most common sources for patient harm and often carry serious outcomes. Giving the wrong medication, giving the wrong dose of medication, giving a medication via the wrong route, and giving a medication at the wrong time are all considered medication errors. Therefore, it is important to always follow the 6 rights of medication administration. These rights include the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. The 6 rights of medication administration must be carried out with every medication administration. Sometimes it is simple to think that the 6 rights of medication administration are so simple and basic that you do not need to follow them anymore. However, you do not need to skip this important process. It was put in place to safeguard both yourself and the patient. I like to think of if you were riding in a car with your child or your parent or your pet or anyone that you loved, and you pulled up to a stop sign at an intersection that you were very familiar with. You would not cross the intersection without checking both ways first. You need to use the same concept when administering medications to patients. Do not slip into poor practice habits because you do this day in and day out. You want to always offer your best practice each and every time you administer medications. This brief lecture covered what a medication error is and the 6 rights of medication administration. It was supported by evidence found in an article titled Collaborating on Medication Errors in Nursing. Thank you for your time and attention. Please do not forget to complete a short survey on SurveyMonkey within the next 3 days. The link will be attached to this video. Thank you.